causes sensitive teeth and how do you fix it? Are there issues with having sensitivity, and is a sensitive toothpaste really the solution to the problem? Well, I'm Dr. Rachel, holistic dentist with over 30 years experience, and I'm going to answer those questions for you today. So I'm going to look at what causes sensitivity, how you can combat that, what you can do at home to prevent it, and do sensitive toothpaste really work? Well, sensitive teeth, they occur because the underlying layer of your tooth, called the dentin, that's the layer under your enamel, it becomes exposed. Now, your dentin contains these microscopic little tubes, like little tunnels, that lead directly to the nerve in the center of your tooth. Now, when these tubes are exposed, any hot, cold, sweet, or acidic food or drink can trigger a painful reaction in your nerves. You get that kind of pain and you just want to stick your tongue on it, you want to rub it, you want to kind of just make it stop. Now, the reason that this happens is because you've either got enamel erosion, and this is the most common culprit. The enamel is that outer layer of your tooth and it's supposed to protect your dentin. Over time, acidic foods and drinks, along with kind of over-aggressive or too frequent brushing, particularly with an abrasive toothpaste or you're scrubbing too hard, that can wear down the enamel, make it thin, and then you've got this exposed dentin. The other reason that's very common is gum recession. As those gums recede, the root surface of your tooth, that becomes more exposed, and those root surfaces don't have protective enamel. They have this softer substance called cementum, which is more susceptible to wear and tear, and this exposes the tiny tubules, leading to sensitivity. Cracked teeth or chipped teeth, cracks or chips in teeth, that exposes the dentin directly. If you've got a crack, it can actually lead right through inside your tooth and down to your nerve, and that can let the hot and cold, sweet and acidic in and cause that sensation. Also, with a cracked tooth, it can be sensitive when you bite down on it or when you've bitten and you let go, and that's because the crack pulls open, stretches those nerve fibers, and you get the signal telling you you've got a problem. Another reason for sensitivity is if you've got a worn down filling. If a filling is worn down, if it's less than 2 millimeters thick, it's no longer going to insulate your tooth properly and you're going to get sensitivity, or it will no longer seal the tooth properly at the edge of the cavity, and that allows irritants to reach the dentin. You could have sensitivity following a dental procedure, and that's quite common and very normal. People tend to forget your tooth is a living thing, and when you get a filling done, or you have a preparation for a crown, or you have a teeth cleaning, for example, that can make your tooth sensitive. You can get sensitivity because of certain habits and conditions, things like teeth clenching and grinding, called bruxism. This puts excessive stress and load on the teeth because you're gnashing and bashing and rubbing them, and that can crack your teeth, it can wear the teeth, but it also crushes the root against the protective membrane, and that crushes the blood supply and the nerve coming up into your tooth, so that whenever you then stimulate your tooth, it's overreactive. It's like if you don't feel well, you've got a bit of a headache, every loud noise is just heightened. Then things like reflux, constant vomiting, bulimia, this acid in the vomit, it erodes the tooth enamel and makes them more sensitive. Apple cider vinegar, lemon juice, exposure to acid frequently, soft drinks that are carbonated, they will all strip your enamel and make them more sensitive. Gum disease, this can cause gum recession and exposes the root of the tooth. It also can make the gum peel away from the root, and you can get stuff going down into that pocket or gap, and that causes sensitivity. Tooth decay, if you've got a cavity, that will make your tooth sensitive, and if you've got a nerve that is inflamed and starting to die, which means it needs a root canal, then you can also have sensitivity. So it would be wise, if you are experiencing sensitivity with your teeth, Wow, I've said that word a lot in this video. If you are experiencing that level of discomfort, then you should just check with your dentist first to rule out these other causes for sensitivity. Sensitive toothpaste, how do they work and do they actually do the job? Well, there are ingredients in those toothpastes that help plug up those tubules. That's one way of reducing sensitivity. The other way is that there can be ingredients in there that kind of calm and sedate the nerve so it doesn't signal as strongly. Now, if you're sedating or calming the nerve, you're not actually fixing the problem. You've still got that exposed area and you've still got that ingress into the tooth. Now, I think it's a bad thing to not know that your tooth's actually got a problem and is sensitive, by blocking the signal. We should be actually putting something into that tube, getting minerals in there, and creating a physical barrier so that we're rebuilding and protecting the tooth and not just switching off the messenger. So potassium nitrate, this is one of the ingredients in sensitive toothpaste. It works by desensitizing that nerve and sedating it so it doesn't respond as much. Now, there can be ones with things like fluoride, and that's going to strengthen the enamel and make it more resistant to wear and tear, and it's also going to plug up and block those tiny tubes. Now, not everybody likes to use fluoride, and as a more holistic approach, we prefer to have things that are natural and not chemical. So we'd look at something like hydroxyapatite, which is calcium and phosphate, the building blocks of your teeth, to help fill in those little porous areas and strengthen the tooth. So you can use the desensitizing toothpaste. You can go your kind of Sensodyne, or you can go something a little bit more natural, something like Biomin is a very good one. Grants here in Australia do a very nice desensitizing toothpaste as well, and we get very good results with those. But what other things can you do? Well, essentially you want to look at remineralizing your teeth. So you want to be reducing the amount of sugar, the frequency of sugar, and the frequency of acidic things. Limit those to meal times, maybe to reduce the amount of snacks that you're having as well, so that you're not having like maybe 5 or 6 exposures during the day. Look at soft drink and that sort of thing and swapping that out for water. You want to have a diet that's high in minerals, alkalizing. Look at things like sodium bicarbonate, baking soda, so you can make a mix of water and swoosh that around your mouth, and that's going to help alkaline and remineralize the teeth as well. Other things that you can try are things like coconut oil pulling, xylitol, so xylitol mints or gum after you've eaten. That stimulates saliva and brings in the minerals, helps to reharden the teeth. Xylitol also works by starving the bacteria that are the ones that cause decay. The reason they cause sensitivity and decay is because they eat sugar, then they poop out acid, and that acid dissolves your tooth enamel, demineralizes it, makes it porous, and then the bacteria can actually get inside your tooth. And obviously they're going to be sensitive. So if we can stop that demineralization from the bacteria happening, then you're going to get less sensitivity. You want to have a diet that's high in calcium-rich foods, so things like leafy greens, nuts, salmon, sardines. These are all high in calcium. If you're going to take a supplement, then you want to make sure that you're getting vitamin D3, calcium and K2, and some magnesium as well, because they all work together to help get the calcium where it needs to go and make sure that calcium is not going to end up in your arteries and making those stiff and putting you at risk of heart disease. If you already have sensitive teeth, then you probably want to have a more soft toothbrush so that you're not causing more damage, but you also need to make sure that you are actually brushing your gums and high up onto the gums, like under your lip down here, so that you're actually stimulating the gums to keep them healthy. I'm going to have to disinfect my hands now. And make sure that you're brushing well, getting all the plaque and food off. Make sure you're brushing for the right amount of time, at least 2 to 3 minutes. Clean in between your teeth with floss, proxy brushes, or a water pick, jet washer, jet flosser. You can use a salt water mouth rinse as well, but the mouth rinse I like is a combination of baking soda and hydrogen peroxide. I'll link to a video on that for you. You can use things like clove oil, aloe vera, because they're anti-inflammatory, they're very soothing. Clove oil is quite sedative for the tooth as well. It's very kind of naturally numbing. So just a little drop of clove oil with some olive oil. You can just swab that around. Do your coconut oil as well. Use your desensitizing toothpaste. If after doing all that, your teeth are still sensitive, then there are things we can do in the dental clinic for you. There are really concentrated desensitizing products that we can apply, like little varnishes and gels that we can put on there. Or if you've got like quite a gouged out area at the gum line, which some people get when they've been clenching and grinding their teeth, or they're scrubbed too hard for many years, that might need a little coating filling. Or if your enamel's been eroded away from acidity, then you may need a rebuild up filling over the surface to stop that sensitivity. Now, if you want to know more how to strengthen your teeth and gums, then check out this video over here.